Welcome to Magnolia Medical Minutes, your local source for medical advice, direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens with SuperTalk Mississippi Media, and today's special guest is radiation oncologist, Dr. Micah Monaghan. Thanks for joining us today.
Thanks for having me.
So the topic today is pancreatic cancer. Tell us a little bit about that.
The pancreas is an organ in the upper abdomen as part of the digestive system. It has some hormonal functions, but primarily the digestive system. And when we're talking about pancreatic cancer, we're really talking about adenocarcinoma, so a cancer that develops in the digestive portion of that organ. I think it's important to note that in 2023, it was the fourth most likely cancer to take someone's life in the United States.
Knowing that, we want to know the early signs to detect it, right? So what are some symptoms or early signs of pancreatic cancer?
Commonly what presents is changes to bowel habits, unexplained weight loss, upper abdominal pain, or jaundice are things we often think of as, we better get that checked.
How is pancreatic cancer going to be diagnosed?
So if you present to your doctor with some of the symptoms we talked about, they may want to start with an ultrasound, but probably the one best test would be a CT scan. That allows us to see inside your body. We can evaluate the liver, the pancreas, the stomach, large and small intestine, all the organs that could be related in that symptom. So it's most commonly found on a CT scan. Now, once we see that there's a mass or a problem and we want to evaluate it more, many people would undergo endoscopy. So they're able to evaluate all those organs. If and when they see a mass, they often would be able to take brushings or a biopsy of the area to send to pathology to either rule in or rule out carcinoma.
If it's been diagnosed and been found, what are the treatment options?
Those that can go to surgery right away may go and have that portion of the pancreas removed in a fairly large operation, and it would often be followed by chemotherapy. For those that we aren't sure that we can remove it all right away, what we call borderline resectable, they may receive chemotherapy on the front end, or sometimes add in radiation therapy to try and shrink this tumor. If we're going to do surgery, we want to be successful and remove it all. And those that are not a candidate for surgery, then multi-drug chemotherapy with or without radiation therapy is often used to try and control the tumor.
So lastly, what can patients expect when receiving these different types of care?
If you're receiving a chemotherapy, often that's delivered in courses, and that can be for several weeks up to several months, either before or after surgery, as we talked about. For those that need radiation therapy is most commonly a Monday through Friday treatment for 5 to 6 weeks. Most folks are able to be out of the hospital and receive their treatment, with symptom control being quite good with our modern medications.
Well, I appreciate your time today to talk about this important topic. Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical advice direct from the doctors at MRHC in Corinth.